Hello, everyone, and welcome to PCR's March Tips and Virtual Transition Times meeting. My name is Melissa Wyman, and I am PCR's Respite Care and Community Engagement Director, and I will be your moderator this evening. We are so excited to be collaborating with Montgomery County Public Schools, MCPS Transition Services Unit to provide an enhanced transition times program for transitioning youth, their families, and caregivers. We are pleased to offer this presentation with American Sign Language simultaneous interpretation, as well as Spanish simultaneous interpretation. To access interpretation services, please select the interpretation icon at the bottom of your screen. Choose Spanish for Spanish interpretation. You may also mute the original audio if you prefer to hear only one language. Both the English and Spanish versions of this presentation will be archived on the PCR's website Transition Times page. A quick Zoom reminders. We are using the webinar platform. Click Show Captions to enable captions for the webinar and select your preferred language. Since we have a lot of information to cover, we will be handling questions a bit differently this evening. Please submit your questions in the chat box below, or you can email them directly to my email, mwyman@pcr-inc.org. We will put that in the chat so that way, and we'll remind everybody at the end as well. After the presentation, Michael will answer the questions and responses will be compiled into a document that will be emailed to participants and archived on the PCR website. Please note that we can only accept general questions and are not able to address specific individual situations. We are very excited for tonight's special Medicaid 101 presentation and are grateful to have the extraordinary Michael Dalto from High Note Consulting, LLC. Michael Dalto is a big old benefits geek. He has been helping people with disabilities and their families understand and navigate public benefits like Social Security and Medicaid for 37 years. He consults with nonprofits, government agencies, and universities throughout the country and has done presentations for Potomac Community Resources for 5 years. He is a firm believer in brief introductions. Michael?
Thank you very much, Melissa. And thank you for allowing me to present to one of my very favorite audiences. So one day, Moses, Jesus, and God decide to go golfing. And they go to the first tee, and Moses steps up to the tee. And it's a huge par 5 hole, well over 500 yards long. And Moses takes a mighty swing and drives the ball over 500 yards. It lands on the green and dribbles to within a foot of the cup. And Jesus says, "Not bad," and steps up to the tee and takes an equally incredible swing and hits the ball, and it lands within 6 inches of the cup. Then God steps up, takes an equally mighty swing, but tops the ball badly. It's rolling on the ground, only about 50 yards, and it's just about to roll to a stop when suddenly an enormous golden eagle swoops down out of the sky, grasps the ball in its talons, and starts flying over towards the green. It flies past the green. It's about 100 yards beyond the green when suddenly enormous hurricane force winds hit the eagle in its face. It's flapping its wings furiously, but it's being swept backwards until it's over the green when suddenly a storm cloud appears overhead. A lightning bolt shoots out of it, strikes the eagle on its tail. The eagle shrieks, drops the ball, and it lands right in the cup. And Jesus looks at God and says, "Are you going to screw around, or are you going to play golf?" And I think of that joke when I think about the Medicaid system, because you would think that if the goal of a program is to help people, there would have to be an easier, more direct, more readily understandable way to structure the program. Unfortunately, that's not the case with Medicaid. Um, but the good news is I will do my level best to make this understandable, and it's going to be worth your while, I guarantee, because Medicaid is almost certainly by far the most important public benefit that your family members with disabilities receive, or I hope will receive if they don't already. Not only because it covers medical services, but perhaps even more importantly, it can cover services provided by DDA, the Maryland Developmental Disabilities Administration. So our objectives are to consider what Medicaid is, kinds of services it covers, the role it plays in enabling people to get services from DDA, some common coverage groups, those are pathways to Medicaid for people with disabilities, who's eligible for each of the coverage groups, how a person can transition among coverage groups if they lose eligibility for one, how they may be able to enroll in another one. In Maryland, Medicaid has a wonderful way of interacting with Medicare that we'll be discussing. We'll talk about the impact of HR 1, the big bill, on Medicaid. You've all heard horror stories about it. I'm happy to tell you the news is not as bad as what you've likely heard. And then finally, how you can get help with Medicaid issues from a certified benefits planner who can really help troubleshoot problems. So I wanted to make this fairly interactive. I've got a number of true-false questions that are peppered throughout the presentation. One of them is multiple choice. I think all the rest are true or false. And you're not expected to know the answers to these. It's just a way for you to guess, stay involved in the presentation. And if you can just type an answer, a T or an F in the chat, that would be great. Would love as much participation as possible. So first question, Medicaid is a government medical benefit that provides comprehensive health coverage for certain groups of people who meet financial limits. Is that true or false? We'll give you about 10 seconds to type answers into the chat. Thank you very much for those of you who are participating and humoring me. And again, you're not expected to know all the answers. In fact, I would be worried if you knew all the answers because it would mean you're an even bigger nerd than I am. So it looks like we're getting a whole lot of true answers, and true is correct. So Medicaid is a government program, and it's jointly funded by the federal government and the state government. Next, in Maryland, Medicaid is also known as medical assistance. Is that true or false? Okay, so we've got a variety of answers this time. In fact, it is true. And this underscores one of the cardinal rules for bureaucrats trying to confuse the public. Give some benefits more than one name. Keeps everyone off balance. It's also worth noting that Medicaid is very different from Medicare. another medical benefit we'll talk about a bit later. And that underscores rule number 2 for bureaucrats trying to confuse the public, which is give very different benefits, very similar names. That really confuses people. But in Maryland, Medicaid equals medical assistance, two different names for the same benefit, but they're very different from Medicare. Next question. To be eligible for Medicaid, a person must be a member of a certain large category of people, such as people who are disabled or at least age 65, and fit the criteria for a specific pathway to Medicaid, such as by receiving SSI, Supplemental Security Income. Is that true or false? Okay, very good. Again, we're getting a mix of answers. Majority are saying true, and it is true. So each pathway to get Medicaid is called a Medicaid coverage group or a Medicaid eligibility group. Next question. This is the only one that's multiple choice. How many Medicaid coverage groups does Maryland have? 14, 23, 42, or 60? Okay, this is great. We're getting a wide variety of answers, and including some that weren't even choices. But the correct answer is actually 60. There are 60 different ways to get Medicaid in the state of Maryland. There are more ways to get Medicaid than there are ways to leave your lover. But fortunately, there are only a handful of those 60 that are commonly used by adults with significant disabilities. And we're going to focus on those. So you're not going to have to endure 60 different coverage groups. So when a person gets Medicaid through any of those coverage groups, what kinds of services does it cover? Well, it covers a wide variety of medical services that anyone might need and that you would expect health insurance to cover. I'm not going to read through them all. They appear on the next several slides. Did want to mention a few. Hearing aids, just a few years ago, became covered for anyone, including adults. It used to be that hearing aids were only covered for people under age 21. Medical daycare services, psychiatric rehabilitation services in the community. Some of you may have family members who are receiving services from those agencies. They can bill Medicaid for them. Personal care services for people with physical disabilities, substance abuse treatment, through local health departments, people on Medicaid can even get free transportation to and from services that are covered by Medicaid if they don't have alternative transportation. Some dental services, private duty nursing in one particular Medicaid program, but not necessarily for everyone. School-based services that are health related. So it really covers quite a bit. But I was asked to focus especially on services from the Maryland Developmental Disabilities Administration, or DDA. and Medicaid does cover those services. So how can a person use Medicaid to get services from DDA? Now, there are a variety of criteria that a person must meet to get services from DDA. I won't be covering all of them. I'm just going to focus on the requirement to have Medicaid. So for Medicaid to cover DDA services, the person obviously has to have Medicaid, and they have to enroll in a funding arrangement called the Community Pathways Waiver. A Medicaid waiver program, including the Community Pathways Waiver, is a funding mechanism for people, certain groups of people with disabilities, to get services they need in the community rather than in an institution. So what is the Community Pathways Waiver specifically? Well, it's one of 6 Medicaid waiver programs in the state of Maryland. And this is the largest one. This one serves the most people by far of any of the Medicaid waiver programs in the state. And it provides services through DDA to people with intellectual and developmental disabilities. And those services are provided in the community. That is now the only Medicaid waiver program that's administered by the DDA, the Developmental Disabilities Administration. But some of you may remember that there used to be 2 other smaller Medicaid waiver programs that DDA operated, called the Community Supports Waiver and the Family Supports Waiver. But those were rolled into the Community Pathways Waiver on October 6th of last year. So this is one delightful example of a government program actually being a little bit simplified recently. Now, I had mentioned earlier that Medicaid is a partnership between the federal government and the state government. Each government contributes a certain amount for the services Medicaid provides. And in Maryland, that split is about 50-50. Each, the state and federal government each pay about half of the cost. And those of you who've been around this system a while might have heard about people who did not have Medicaid or were not in the Community Pathways Waiver for some other reason, but were receiving services from the DDA. That's become increasingly rare. The state has said, no, we need everybody who gets DDA services to be in the Community Pathways Waiver. And it's easy to understand why. Because if the federal government is covering roughly half the cost, if a person is in the Community Pathways Waiver, that saves the state a lot of money compared to what happens if a person's not in the Community Pathways Waiver and they're getting services from DDA, in which case DDA and the state have to pay 100% of the cost. All right, next question. To get services from DDA through the Community Pathways Waiver, a person must receive SSI benefits. Is that true or false? Okay, majority of you answered false, and false is correct. And you would assume it was correct because I mentioned that there are several Medicaid coverage groups that people with disabilities may commonly use that are a pathway to the Community Pathways waiver. But I included that question because there's a common myth that a person must be receiving SSI benefits in order to get Medicaid that will enable them to enroll in the Community Pathways waiver. And that is not true. A person can be getting Medicaid by virtue of receiving SSI benefits, a cash benefit for people with disabilities that comes from Social Security, but there are several other Medicaid coverage groups that a person can use to get into the Community Pathways waiver. Okay. So now it's going to get a bit detailed. We're going to get into the weeds a bit, but I will try to keep this as simple as possible. There are 6 key Medicaid coverage groups out of the 60 total that exist in the state that adults with disabilities will typically enroll in, and all 6 of them are compatible with the Community Pathways waiver. So a person can be getting Medicaid any of these 6 ways and meet the Medicaid eligibility requirement to be in the Community Pathways waiver. Okay, and I'm just going to list them and then we'll go into specific details about who's eligible for each. So the first is SSI recipients, people who get SSI cash benefits from Social Security. And you'll notice for each of these 6 groups, there is a code. It's a letter, a single letter followed by a 2-digit number. And the code for people getting SSI and automatically getting Medicaid with it is S02. Next is disabled adult children. These are actually people who used to receive SSI, but lost it because they started getting a different benefit from Social Security, a kind of Social Security disability insurance based on the work their parent has done in the past. It's known as a disabled adult child benefit, or DAC for short. That's the S19 code. Next is 1619B, which is a wonderful rule for you to know about. I'm going to spend a little time on that when we talk about eligibility. 1619B is a way that a person can keep Medicaid if they were receiving SSI, but now their earnings from work are too high for their SSI benefits to continue. Next is known as adult magi. Those of you who remember when the Affordable Care Act, also known as Obamacare, began to roll out new programs in 2014. One of them was a different Medicaid coverage group that had not existed before for people with limited incomes, whether or not they had disabilities. And it's often referred to as the Medicaid expansion, because Medicaid expanded a great deal in most states to enroll people through the adult magi group. Next is the Employed Individuals with Disabilities, or EID program. This is my favorite of the 6 groups. This is Medicaid for people with disabilities who are working for pay and meet a few other criteria if they're not eligible for Medicaid another way. EID is basically a reward for working, a way people can qualify for Medicaid if they're working and they don't qualify for Medicaid through a different coverage group. Then finally, number 6 is called the Special Waiver Group with a code of H01. That's kind of the fallback option if a person doesn't qualify for any of the other 5 groups, for them to be able to get Medicaid and be in the Community Pathways waiver. That is a group that's only for people in the waiver and no one else. Now, if you look at the documents that establish the Community Pathways waiver, you'll find that there are a few additional coverage groups that are compatible with the Community Pathways waiver, but in my experience, they so rarely apply to people in the waivers that I didn't even bother listing them. I figured I didn't want your heads to explode. Covering 6 groups, I think, is sufficient. But the 6 we'll cover are by far the most important. All right, next question. To be eligible for a Medicaid coverage group, a person must meet certain financial limits. Is that true or false? Okay, we're getting a whole lot of true answers, and true is correct. So every Medicaid coverage group does have financial limits. Out of the 6 groups that we're looking at tonight, 5 of them have limits on income. One of them does not. And 5 of the groups have limits on resources or assets. One of them does not. So that begs a question, which is, what's the difference between income and resources? So I wanted to explain that. So income is money that a person receives in a particular calendar month. That's subject to a limit on income, the income limit. A resource is also money, but it's not money when a person receives it during a calendar month. It's anything that's left over that carries over into the next calendar month. So if a person received a certain amount of income during the month of March, it's income. It counts against the income limit. If they have any of that money left over that they have not spent or converted to a type of resource that doesn't count, which we'll get to in a moment, that leftover money becomes a resource. And it remains a resource for as long as the person has it. And that's subject to the resource limit. So resources are measured on the first day of each calendar month. So this is a confusing facet of the rules. But in fact, you could receive money in one calendar month, still have some of it left over that you still have the next month that becomes a resource. If your resources are under the limit on the first day of the month, then you meet the resource limit. If you've got more money in the middle of the month, let's say you start getting other income that month, that won't matter because your resources are not counted again until the first day of the next calendar month. So you need to make sure that your resources on the first day of each calendar month are below the limit. And it's not all income and all resources that count against the income and resource limits. Some types of income and resources don't count at all, and some types that do count, some types of income that do count, are not counted 100%. Only a portion of them are counted against the limits. So let's start with resources. So resources, another term for that would be assets. And some examples of resources that do count against resource limits are cash, bank accounts, stocks, bonds, CDs, money market accounts, other types of investments, retirement accounts for most Medicaid coverage groups, but not all, real estate other than the home the person lives in. Those are all examples of resources that do count against resource limits. But very importantly, there are some kinds of resources that do not count against the limits. The primary home a person lives in, even if it's worth $1 million, they own it free and clear with no mortgage. As long as they live in it, it does not count as a resource, doesn't count against the resource limits. So people sometimes ask me, well, what happens if you have two homes? And I'll say, well, only your primary home will not be counted. The second home will be counted, and the Medicaid eligibility worker won't have any sympathy because they don't have two homes. One car is not counted as a resource for some of the groups. In fact, you could have more than one car that would not count. But it's nice to know that you can own a home and a car and still qualify for Medicaid. I believe most or all of you have probably heard of ABLE accounts, special accounts owned by people with disabilities whose disabilities began before age 46. Some of you might be thinking, I thought it was before age 26. It used to be until January 1st of this year. Then the rules improved so that people who became disabled a bit later in life, perhaps after age 26, but before age 46, could still use these accounts. And the money in the accounts does not count against the resource limits for Medicaid and other benefits that have resource limits. Special needs trusts, special accounts set up to benefit a person with a disability, but the person with a disability doesn't technically own the money and they don't control it. Another party, known as the trustee, is solely responsible for managing the money, making withdrawals, spending the money only to benefit the person with a disability. But any amount in a special needs trust, if it's set up properly, will not count against the resource limit for any of these benefits. Business bank accounts. If a person with a disability owns their own business, they have a business bank account. It's important to have the business bank account titled in the name of the business rather than the individual, to make it easier for Medicaid to see that, in fact, it is a business bank account and not a personal account. The money in that account is not counted against the resource limit. Neither are assets that are used in a trade or a business. There are some others, but these are the most important types of resources that don't count against resource limits. Right. So we're going to get back into the 6 key Medicaid coverage groups, and we will be talking about income eligibility for each of them, but I can't give you general information about how income is counted because it's counted somewhat differently for different Medicaid coverage groups. So we'll get into that now. Okay, so here are the details. Anybody in the state of Maryland who receives any amount of SSI, anywhere from the minimum $1 a month to the maximum $994 a month, is automatically and immediately eligible for Medicaid. So it's that simple. So who's eligible for SSI? A person has a severe disability that meets Social Security's criteria. They have to have countable income under the maximum SSI benefit, under $994 a month in 2026. And they have to have countable resources under $2,000. So how do you figure out how much of a person's income is countable? We already looked at the types of resources that do and don't count. We haven't talked about that for income yet. So remember, income is money that you receive during a calendar month. Now, if a person gets income other than SSI that's considered unearned, such as Social Security Disability Insurance, that's SSDI for short, pensions, annuities, interest, dividends, unemployment benefits, workers' compensation benefits, veterans benefits, and a whole bunch of others. Those are all referred to as unearned income. Almost all of that unearned income counts in the SSI program, all but $20 a month of it. But the news is better for earned income. Earned income is money that a person receives as direct compensation for work they performed, such as wages, self-employment income, tips, salaries, royalties, if somebody sells a movie script, for example. These are all examples of direct payment for work performed, and that's called earned income. Less than half of earned income is counted against the income limit. So that's good news. It means people will come out ahead financially if they work and receive earned income. Okay. And to qualify for SSI, you apply to the Social Security Administration. So that's SSI, and that's real simple. Anybody who gets any amount of SSI is automatically and immediately eligible for Medicaid. Next is the disabled adult children. So this is a benefit for a person who used to get SSI payments, but they don't any longer. And the reason they don't get SSI anymore is they began to receive a different cash benefit from Social Security, known as a disabled adult child benefit. Or they were receiving a limited disabled adult child benefit and some SSI, but then their disabled adult child benefit increased enough to stop their SSI. If that's the case, and if the person would still be eligible for SSI payments, if not for the disabled adult child benefit or benefit increase that stop their SSI payments, so if they meet all the other eligibility criteria for SSI, except they've got too much income from the disabled adult child benefit, then they still remain eligible for Medicaid. So who is eligible for the disabled adult child benefit? A few of these slides do have footnotes in the notes section at the bottom. You can't see them on my screen here, but in the PowerPoint that was emailed to you, you'll be able to find these notes. So to be eligible for a disabled adult child or DAC benefit, a person must be an adult, thus disabled adult child. So they have to be 18 or older. Their disability had to start before age 22, and they have to have a parent who is receiving either Social Security retirement or the parent is receiving Social Security disability, SSDI, or the parent is deceased. If those criteria are met, then the son or daughter with a disability can receive a DAC benefit. And if that DAC benefit causes the SSI to stop, they can use this Medicaid coverage group for disabled adult children. Third group, this is my second favorite one, is called 1619B. No need to memorize that. It's just a section of the Social Security Act that created this rule. It is a very important incentive to work for people who get SSI. It also happens to be a Medicaid coverage group. The 1619B rule says this: if you start out getting SSI payments and your income from work, your earned income, rises high enough that it reduces your SSI to zero, you can still remain eligible for SSI, except you're not getting SSI payments. So what good is that? It's good in two ways. It's a double safety net. It's good because your Medicaid continues, even though your SSI payments stopped. And because if you later stop working for any reason or have your earnings drop low enough for any reason, you can get your SSI payments back just by calling Social Security and verifying that your earnings dropped low enough or stopped. So this rule means a person on SSI has nothing to lose working full-time because they can keep SSI eligibility even if their SSI payments stop. They can keep their Medicaid and they can go right back on SSI quickly and easily if anything happens to their earnings later. So to qualify for 1619B, a person had to start out getting SSI. Their SSI payments had to stop because of their income from work. Their income from work needs to be below a certain threshold, which this year in Maryland is almost $63,000 a year. And in some cases, a person can be earning even more than that, and they can still be eligible for 1619B, especially if they're getting higher than average Medicaid expenses, including expenses covered by the Community Pathways waiver. And the person has to be otherwise eligible for SSI. Still have to have countable resources under $2,000. Their countable unearned income has to be under the maximum SSI benefit of $994 a month. Their disability cannot have medically improved. And they have to need Medicaid which is virtually a given. And this is a benefit that Social Security administers as well. So that's half of our 6 groups. The 4th group is the adult magi group. Remember, this is also known as the Medicaid expansion that began in 2014 as part of the Affordable Care Act, or Obamacare. And it was designed to help more adults qualify for Medicaid if they were in families with low incomes. So to qualify for the adult magi group, incidentally, magi stands for modified adjusted gross income, which is a different way of measuring income than the SSI rules use. And the eligibility for adult magi is you have to be 19 to 64 years old, can't be receiving Medicare, have to have family income under 138% of the federal poverty level for the family size. I just listed 2 examples, somewhat over 1,800 a month for one person, a little under 2,500 a month for 2 people would be 138% of federal poverty. There's no limit on resources for this group. You could have $1 million in the bank and still qualify for it if your income is low. And you don't have to have a disability to qualify for adult magi. Most people enrolled in it do not have disabilities, but many do. So what does magi mean? Magi is basically to calculate income using the magi rules. You basically take all taxable income, such as wages, and add all non-taxable Social Security benefits like SSDI, but not SSI benefits. Those do not count as income under the adult magi rules. Number 5, my favorite, the employed individuals with disabilities, or EID group. To be eligible for this one, you have to be 16 to 64 years old. Advocates keep pushing to eliminate the upper age limit and eventually will prevail. But for now, the only really negative thing about the program is it does have an upper age limit. You're not eligible for it once you reach age 65. You have to meet Social Security's medical criteria for disability for adults, such as if you receive SSDI benefits, Social Security Disability Insurance, which could include the disabled adult child benefit we talked about. You have to be working for pay, but there's no minimum amount you have to earn. I've known people earning less than $50 a month from work who still met the work requirement for EID. You have to have countable resources under $10,000. Remember, the countable resource limit for SSI was only 2,000. So this has a resource limit 5 times as high. And you do have to pay a monthly premium, which for most people, it's on a sliding scale. And for most people, it's somewhere between $0 and $55 a month. The most common monthly premium is only $25 a month. Well worth it to qualify for Medicaid. EID is the only one of the 6 groups that has no income limit. Another thing I love about it. People can earn any amount and still be eligible for EID. And you can get information about applying at the link at the bottom of slide 34. And finally, the sixth group is the special waiver group. This one, following that rule for bureaucrats, also has some other names. It's also known as the special income level group or the 300% SSI income level group. And I'll explain why it's called that in a moment. So as I mentioned, this is kind of the fallback option for people who are enrolling in the Community Pathways waiver or who are already enrolled in it, who don't qualify for Medicaid through one of the other 5 groups. To be eligible for it, a person has to be in the process of enrolling in the Community Pathways waiver or must already be enrolled in the waiver. So unlike the other groups, this one requires you to be in the waiver as a condition of eligibility. Have to meet Social Security's definition of disability. You have to have countable income under 3 times the maximum SSI benefit for an individual. Remember, the maximum SSI for an individual is $994 a month. 3 times that is $2,982 a month. That's the countable income limit for the special waiver group in 2026. And that's why one of the names for the group is the 300% SSI income level group. And finally, this group has a countable resource limit of $2,500. It used to be only $2,000, but the state increased the resource limit to $2,500 on July 1st of 2025. So for the special waiver group, countable income is calculated very similarly to the SSI rules, counts almost all of unearned income, less than half of earned income. And you apply for it through the Eligibility Determination Division, EDD, which handles Medicaid eligibility for the waiver. So when you're applying for the waiver, if you don't already have Medicaid in one of the other 5 groups, you'll be applying for the special waiver group at the same time that you apply for the waiver. Okay. I'm going to let you catch your breath here. That was quite a lot to absorb. I did want to tell you, I thought it would be easier if you had a cheat sheet. So another one of the documents you received by email is this Word document, which is Medicaid coverage group eligibility for key groups that are compatible with the Community Pathways waiver. So this shows the 6 key eligibility groups or Medicaid coverage groups and their eligibility for all 6 of them, all within about a page and a half document. Okay. And for those of you who are really gluttons for punishment, I also, just for kicks, provided you with a list of all 60 of the Medicaid coverage groups in the state. And you also received that in an email. Does not give lots of details about them, just pretty much their names and their codes. So we'll get back to our slide deck here. And here's your next question. If a person enrolled in a Medicaid waiver program, including the Community Pathways waiver, loses eligibility for their current Medicaid group, they will lose eligibility for both Medicaid and the waiver. Is that true or false? Okay, so most people said false. That's the answer I was looking for. Now, you could interpret that question either of two ways. You could say, well, if you lose your Medicaid, if you lose eligibility for Medicaid, then you're going to lose eligibility for the waiver as well. But I was looking for the answer to be false because if you're enrolled in one coverage group and you lose eligibility for it, there may very well be a different coverage group that you are eligible for. And instead of just losing Medicaid entirely and losing the eligibility for the Community Pathways waiver, you can transition to a different coverage group that you are eligible for. Keep your Medicaid and keep enrollment in the waiver. So I want to give you two examples of people who are enrolled in one Medicaid coverage group. Something happens that causes them to lose eligibility, but they then transition to a different coverage group, keep Medicaid, and stay in the waiver. So starting with Marisol, who gets SSI payments and Medicaid, she's enrolled in the Community Pathways waiver. She starts a full-time job earning $48,000 a year gross wages, or $4,000 a month. That's high enough income that her SSI payments stop. She still has less than $2,000 in countable resources. She's otherwise eligible for SSI, and she needs Medicaid, particularly for the Community Pathways waiver services. So next question for you, is Marisol still eligible for the SSI recipients Medicaid group? Is she still receiving SSI payments? That's just a yes or no. Okay, we've got a mix of answers. Most popular answer is no. And no is the one I was looking for. If she's not getting SSI payments anymore, then she's not eligible for the SSI Medicaid group. Her countable income with $4,000 a month in earnings is too high to get SSI payments. But now the next question, is she eligible for a different Medicaid group? And if so, which one? This is a good time to pull out your cheat sheet with the 6 different Medicaid coverage groups on it. And there is one that she is definitely eligible for. I'll tip you off on that. Let's see if you can figure out which one it is and type it into the chat. Okay, we've got a split, um, two popular answers, 1619B and EID. And I can definitely see the logic in both of them. The one that I'm looking for is 1619B. EID is a tempting answer because she's working, she's got a pretty high income, she's not eligible for SSI anymore. EID is for working people. But 1619B is better for her for a couple of reasons. One is it would enable her to keep SSI eligibility, and that means she'll not only keep her Medicaid, but if something happens to her job later, she'll be able to go right back on SSI. EID does not accomplish that. And number two, remember, EID has a monthly premium you have to pay for most people enrolled in it. 1619B does not. That's free. Okay. So Marisol started out getting Medicaid through SSI. She's no longer eligible that way, but she is eligible through the 1619B group. So if she switches to the 1619B group, will she still be eligible for the Community Pathways waiver? Yes or no? Okay. Overwhelmingly popular answer is yes. And that's absolutely true. 1619B is one of those 6 key groups that are compatible with the Community Pathways waiver. So even though her SSI payment stopped, she can still keep Medicaid and stay in the waiver. Now let's do another example. Mahmoud receives SSDI payments of $2,850 a month. His countable resources are $1,500. He's not working. He's enrolling in the Community Pathways waiver. So which Medicaid group is he eligible for when he enrolls in the waiver? Again, you may want to check your cheat sheet on this one. There's only one that he's eligible for now. Okay, anyone else care to weigh in on this? We didn't get quite as many answers this time because it's a little more complicated. But the most popular answer is the correct one, which is the special waiver group. Remember, that's got a countable income limit of $2,982 a month. Mahmoud's income is below that. Countable resource limit of $2,500. His resources are only $1,500. He is enrolling in the Community Pathways waiver. So he's eligible for the special waiver group. Okay. But now Mahmoud starts a part-time job and earns $1,000 a month gross wages. He still gets $2,850 a month from SSDI, still has $1,500 in countable resources. So is he still eligible for the special waiver Medicaid coverage group? Particularly look at his income. Okay. Most of you who answered said no, and no is correct. The reason is, remember, the countable income limit for the special waiver group is $2,982 a month. He's got $2,850 a month of SSDI. Almost all of that counts against the limit. And he's got $1,000 a month of gross wages. A little less than half of that counts. So if you add a little less than half of 1,000 to slightly less than 2,850, the remaining amount is close to $3,300. It's well over the $2,982 a month countable income limit for the special waiver group. So he now has too much income for the special waiver group. But is he eligible for a different group? And if so, which one? I'm going to go back to this slide so you can see his income, his resources, and determine whether he would be eligible for another group, and if so, which one. Okay. Most of you who answered EID. And EID is correct. His income is too high for any of the other five group. Well, he's not eligible for some of the groups. He's not getting SSI. He has not received SSI before, so that rules out the SSI, disabled adult child, and 1619B groups. His income is too high for the adult magi group. We already established his income is too high for the special waiver group, but that leaves EID. And remember, that's the one group that has no upper limit on income. So no problem with the income. And the countable resource limit for EID is $10,000. He's only got 1,500 in countable resources. Okay. So he's not eligible for the special waiver group, but he is eligible for EID. So if he switches from the special waiver group to the EID group, will he still be eligible for the community pathways waiver? Okay. So I think pretty much everybody is saying yes, and yes is true. So what is the takeaway here? The takeaway is if your family member is enrolled in the Community Pathways Waiver or they're enrolling in it, there are ways that they can stay eligible for Medicaid and the Community Pathways Waiver, even if they work and have substantial earnings from work. If necessary, they may be able to switch from one Medicaid coverage group to another that's still compatible with the waiver. So I find that the EID group is probably the most helpful tool to help many people either become eligible for the Community Pathways waiver or remain eligible for the Community Pathways waiver. There are many people who are not eligible for any of the other 5 groups that are compatible with the waiver, but are eligible for EID or are almost eligible for EID, but they're not working. A lot of people out there who meet all the eligibility criteria for EID, except they're not working. If they went to work for pay, then they would be eligible for EID. So EID is a powerful incentive to work for many people because it enables them to qualify for or remain eligible for the Community Pathways waiver and for the other services that Medicaid covers. EID is the only group that has no income limit, the only group in the state. So that's the only one out of all 60 groups. That's the only one that has no income limit. And it has the highest resource limit of any of the 6 groups that have a resource limit. The Adult Magi group has no limit on resources, but has a pretty low income limit. EID does have a resource limit, but it's the highest of any group that has a resource limit. So this can be a great pathway to become eligible for the waiver or to remain eligible for the waiver if you're in a situation like Mahmoud, where you go to work, lose eligibility for one coverage group, but then switch to EID. And I wanted to give you an example. So here's Christine, who gets $3,200 a month from SSDI and has total resources of $8,000. She needs services from the Community Pathways waiver, but she's not eligible for any of the Medicaid coverage groups that we've discussed. Not one of them. Her income is too high for the special waiver group. She doesn't qualify for SSI, disabled adult child, 1619B, or adult magi. But she starts part-time work earning $1,200 a month gross wages, and now she's eligible for EID because before she started working, she met almost all the criteria for EID. She's disabled under Social Security's definition. She's getting SSDI. Her resources are under $10,000. She's got only $8,000. We'll assume that she's between 16 and 64 years old. There's no income limit for EID. The only criterion she did not meet was she was not working. All she has to do is go to work. And she doesn't have to earn $1,200 a month. She could earn under $50 a month from work, still meet the work requirement, still qualify for EID. And that's her pathway into the waiver. Okay, so hang in there. I'm going to catch my breath here. I think we only have about 8 slides left, and then we'll go ahead and open the field to questions. But I wanted to talk a little bit about the Medicaid eligibility process for the Community Pathways waiver. So some of you are familiar with the Eligibility Determination Division. They have a unit called the waiver unit that determines Medicaid eligibility for people who are either enrolling in or already enrolled in the Community Pathways waiver. and that's supposed to be done at least annually. But the Eligibility Determination Division, EDD, only determines actual eligibility for one of the 6 coverage groups, and that's the special waiver group. And remember, that's the fallback if a person doesn't qualify for any of the other 5 groups. If a person is enrolled in any of the other 5 groups, SSI, disabled adult child, 1619B, EID, or adult magi, then the Eligibility Determination Division only has to verify that the person's enrolled in that coverage group. They don't determine eligibility for the group. A different agency does that. So if the person is not enrolled in one of the other coverage groups, then EDD evaluates their eligibility for the special waiver group. That's the fallback option. All right. So talk about these 6 Medicaid coverage groups. How do you know which one your family member is enrolled in? You probably know if they get Medicaid, also known as medical assistance, but you may not know which coverage group they have. So there are several ways to do it. If the person is already enrolled in the waiver, they should have someone called a coordinator of community services, or CCS, an advocate, a service coordinator, to help them. And that CCS person has access to an online tracking system called LTSS, stands for Long-Term Services and Supports. And the CCS can find the person's coverage group in that LTSS system. That's one way. Another way is you can contact a healthcare provider or a DDA service provider who's serving your family member. So a service provider or a healthcare provider who is participating in Medicaid, and they can use another online system called EVS. That's the Eligibility Verification System. And they can type in your family member's Medicaid number and find out which coverage group they're enrolled in. And again, it's going to be that code, a single letter followed by a 2-digit number. And your cheat sheet does show what the code is for each of the 6 groups. And there's a third way you can find out a person's coverage group. You can call a toll-free number, 800-492-5231. You select option 2, and you generally need to have the individual on the phone with you. If you're a parent or another family member, they may give you the information without your family member being on the line with you. But what you'll need is the family member's Medicaid or medical assistance number or their Social Security number. And the person who answers that line should be able to tell you what the coverage group is. And you can tell them, I'm looking for the coverage group code, the letter followed by the 2-digit number like S02 for SSI, etc. Okay. Now, I wanted to talk a little bit about the interaction of Medicaid with Medicare. So they're very different medical benefits, But Medicaid can be really helpful to a person who also has Medicare. So who has Medicare? Well, we think of Medicare as being insurance for people who are 65 or older. And the great majority of people who get Medicare get it based on their age, being 65 or older. But people with disabilities who are younger than 65 can also get Medicare if they're getting SSDI, Social Security Disability Insurance, which they might receive based on their own work history. If they've worked and paid Social Security taxes on their earnings for a long enough period, they can get SSDI benefits from Social Security based on their own work history, or that disabled adult child benefit we talked about earlier, which is Social Security disability you get based on a parent's work history. If you get those benefits, you also get Medicare, but only after a 2-year wait. You have to be entitled to SSDI or the disabled adult child benefit for 2 years before Medicare starts. Now, most people who are enrolled in Medicare have to pay for it, and some people pay through the nose for it. There are various costs associated with different parts of Medicare. There are monthly premiums, deductibles. A deductible is an amount that you have to pay out of pocket before Medicare starts paying for anything, and coinsurance. So Medicare might cover 80% of an expense. The individual usually has to pay the other 20%. But the state of Maryland has a very generous um, rule regarding Medicaid and Medicare. If you get Medicare in the state of Maryland and you get Maryland Medicaid through any of those 6 coverage groups we looked at, your Medicaid will make your Medicare virtually free. It wipes out almost all the out-of-pocket costs for Medicare. So having Medicaid is a great thing if you also get Medicare. It makes your Medicare virtually free in the state of Maryland. The rule is not that generous in most other states. Okay, and for those of you who've been panicking ever since HR 1, known officially as the One Big Beautiful Bill Act, passed July 4th of 2025. Been lots of stories about how HR 1 is going to seriously hurt Medicaid. And I wanted to let you know the news is not nearly as bad as you might have heard and you might have feared. HR 1 does have a big impact on Medicaid, but only on one of the 6 coverage groups that we've discussed, only the adult Magi group. Now, if your family member has a very significant disability and is getting Medicaid, it's very likely they're getting Medicaid through a different group besides the adult Magi group. And that means that their eligibility for Medicaid is not affected by HR 1. Now, if a person is enrolled in the adult Magi group, HR 1 was designed to, I'm going to get on my soapbox here for a moment. It was designed to limit eligibility, to limit the number of people enrolled in the adult Magi group in the guise of preventing waste, fraud, and abuse. What they said was, well, we're making changes in the rules to make sure that people who are not eligible don't stay enrolled in the adult Magi group, the Medicaid expansion group. And they're doing that by saying, well, instead of having to have your eligibility redetermined once a year, they're going to require people to go through redeterminations every 6 months. What that really accomplishes is more headaches, more paperwork, more administrative hassles, and a greater likelihood that people who are eligible will be dropped from the adult Magi group simply because they couldn't handle the red tape. They're also requiring most people in the adult Magi group to work at least 80 hours a month. But there's an exception for people with disabilities in the adult Magi group. People with significant disabilities will be exempt from the work requirement. Now, the problem for people who may not even be in the adult Magi group is that HR 1, by requiring states to do double the amount of eligibility determinations for this large Medicaid group, and to limit a funding source that states use to provide their share of Medicaid contributions, so their funding for Medicaid, which is taxes on healthcare providers. HR 1 limits those. As a result, HR 1 is going to cause states to have to limit the services or eligibility for other Medicaid groups in some cases, because it's going to consume more administrative costs, require states to come up with money to pay for all those extra eligibility workers. It's going to limit one funding source that states use as their share of Medicaid costs. And as a result, states are going to have to cut the Medicaid budget somewhere. So it is possible that some services funded by Medicaid could be reduced or eliminated. I cannot predict how that's going to play out, but I do not expect that services through the Community Pathways waiver will be dramatically cut. Some of you are familiar with some cuts that DDA is in the process of making, limiting the maximum budgets for people in the Community Pathways waiver, making cuts in certain allowable payments to providers for people who have self-directed services, that sort of thing. So I'm not saying there's no pain here at all, but I don't believe it's going to be an overall disaster. And very importantly, HR 1 does not affect eligibility for any of the other 5 Medicaid coverage groups, only for the adult Magi group, which your family member is likely not enrolled in anyway. So, what if you need help navigating this system? Let's say you have a family member who wants to go to work or is already working and might be able to take advantage of the 1619B group or the EID group. Or your family member is enrolled in a Medicaid coverage group and you find out what it is and you think, gee, I don't think she should be enrolled in, let's say, the special waiver group. I think she should be in the disabled adult child group. Why isn't she? you can get free benefits counseling to get help with this. If your family member gets SSI or SSDI and is either working or actively seeking work, you can call the Maryland Work Incentives Network, Maryland WIN, at 240-638-0071, and they can help you. If your family member has a case open with DOORS, the Maryland Division of Rehabilitation Services, the DOORS counselor is required to arrange benefits counseling for them. Actually, I think they may have eliminated that as a requirement very recently because of budget cuts at DOORS, but they are still paying for benefits counseling. Either of those two ways, you can get help from a benefits counselor resolving issues involving Medicaid coverage groups and any other public benefits that your family member receives. And I know that Melissa at some point is going to put into the chat for those of you who would prefer to hire a professional, is going to give you the names and email addresses for two of my excellent colleagues who do provide private consultations and oftentimes may provide quicker services than the free benefits counseling options we've got available. Okay. And Melissa, I'm very happy to report we've got plenty of time for questions.
Awesome. Okay, so what we're going to do is I have a few questions, and then Patricia actually has been putting all of the questions together. So thank you, Pat. So one of the questions that I think the most popular question that we've been receiving is how does hold on one second, let me everybody's doing the chat. Okay. Please remind us how we know which coverage group our child is in.
Okay. So I'm going to go back to the several slides that address that. There are three ways you can determine your family member's coverage group. And they appear on slides 57 and 58. I think it's just those two. Three ways. One is contact your coordinator of community services and ask them to look in the LTSS, long-term services and support system. Another way is to contact a healthcare provider or a DDA service provider who is billing Medicaid for their services to your family member and ask them to look in the eligibility verification system, EVS. And they should be able to find the coverage group there. If neither of those works, or you just would rather do it yourself without help from someone else, you can call the phone number on slide 58 and follow the instructions there. Probably a good idea to have your family member on the line with you in case the person who answers the phone says, well, I can't give you information without the individual either being present or without a signed consent, written consent from the person. Okay.
Okay, great. So then we have another question. So young people who are on the DDA waiting list and may only become eligible for services if and when a parent dies or is incapacitated. Many of these young adults now have jobs with 401k retirement plans, and they will have accumulated more resources than Medicaid allows by the time they are approved for DDA services. What should they do with that kind of asset?
It's a great question. Um, so it's been common in the past that people who were enrolled in the waiver and who were in the special waiver Medicaid group could have their Medicaid eligibility for the special waiver group stop because they had 401k plans or other retirement plans that began to accumulate and eventually brought their countable resources over the limit, which is currently $2,500. If that were to happen to a person who was enrolled in the waiver, or a person who wanted to enroll in the waiver and needed to be sure they could get Medicaid compatible with the waiver, they could use EID instead. Two reasons. One is, remember, EID has a countable resource limit of $10,000, not $2,000 or $2,500. And also, here's a point I did not mention about EID. EID does not count any money in retirement accounts against the resource limit. So you could have way more than $10,000 in a 401k, a 403b, a pension, a an IRA, a Roth IRA, um, a TSP, a thrift savings program, which a lot of federal workers receive. Any of those retirement funds do not count against the $10,000 resource limit for EID. So the short answer to your question, Melissa, is they can use EID if they're working. And if they're not working, but they meet all the other eligibility criteria for EID, then they should go to work.
Okay, great. And then that actually just created a question someone just asked is, can you go a little bit more into detail of how you apply for EID for someone asked for their child?
Yes, I'm going to go back to page on EID eligibility, and there's a link to information about how to apply. Just past it. There it is. It's slide 34, has the eligibility criteria, and a link at the bottom of the slide to the page on the Maryland Department of Health website that deals with EID. It's got the application there you can download. It's got a list of documents to enclose with the application. I believe it still lists agencies that can help you with the application if you'd like. There are 7 agencies in the state known as Centers for Independent Living, and one of them is the one that serves Montgomery and Prince George's counties. It's called Independence Now, and if you contact them, they can help you with the EID application.
Okay, great. And then another question we had is, can someone apply for EID if they have a seasonal job, or do they need to have a full-time job?
Another great question. Somebody who's employed seasonally can still be enrolled in EID. You have to be working for pay to be enrolled in EID. But once you're enrolled, if you become unemployed, even temporarily, through no fault of your own, such as you were laid off, it's seasonal work, you had to go on medical leave, you were fired, so you didn't choose to separate from the employment, then there's a 6-month grace period where you can remain enrolled in EID for up to 6 months in a 12-month period if you're not currently employed for one of those reasons beyond your control. So somebody who's working, let's say, 6 or 7 months a year, and then they're off for 5 or 6 months, can take advantage of that unemployment grace period and remain enrolled in EID while they're not working. They still have to pay their premium, but their premium may be lower when they're not working because the premium is on a bit of a sliding scale. So if you're no longer working, your income is lower, your premium may be lower as well.
Okay, great. Thank you.
Uh-huh.
Okay, so can you explain how your adult child moves from SSI to DAC following parent retirement? Is there paperwork, and can you give us a little bit more clarification on that?
Yeah, it's a really good question because although the rules are very clear about how people should become eligible for the disabled adult child benefit and keep their Medicaid, even though their SSI has stopped, there are many people who fall through a crack and who lose eligibility for Medicaid, even though they should have kept it through this disabled adult child coverage group, right? Now, if a person starts out on SSI, SSI is considered a benefit of last resort. In order to be eligible for it, you have to apply for and accept any other benefits you may be entitled to that Social Security directs you to apply for, especially any kind of Social Security disability, including the disabled adult child benefit. So if you get SSI and your parent retires, becomes disabled, and starts getting Social Security disability, so the parent's either getting Social Security retirement or disability, or the parent passes away, then eventually Social Security will realize that and say, oh, we need to switch this person over to a disabled adult child benefit. But it can usually be to the individual's advantage to switch to the disabled adult child group. It's usually a higher monthly benefit, and they can still keep Medicaid. And after being eligible for the disabled adult child benefit for 2 years, they can also get Medicare. So if you believe your child is now eligible for the disabled adult child benefit, you should contact your local Social Security office and inquire about that and apply. And again,
Okay.
I'm sorry, Melissa, the eligibility criteria for the disabled adult child benefit appear in the notes, like a footnote at the bottom of slide 30, which you can see in your PowerPoint. You just can't see it on my screen. What appears on the screen is the eligibility for the disabled adult child Medicaid coverage group, not for the disabled adult child cash benefit.
Okay. And one last question. Can the SSI resource limit affect Medicaid and the CP waiver if the person is on SSDI?
Um, I want to mention a common myth that I have even found some people who worked at the eligibility determination division to perpetuate. These are people who should definitely know better. And that myth is that in order to be enrolled or stay enrolled in the Community Pathways waiver, you have to have countable resources under $2,500, and you have to have countable income under $2,982 a month. That is not true. The waiver itself does not have financial limits. It's the Medicaid coverage groups that have financial limits. So you have to meet the financial limits to be enrolled in one of the 6 Medicaid coverage groups. But there are no financial limits for the waiver itself. Okay. So I wanted to mention that off the bat. Now, um, so when you're looking at any of the financial limits, resources, income, all you need to do is make sure that you meet the financial limits and the other criteria for one of the 6 coverage groups. If you meet those criteria and you enroll in that coverage group, then bingo, you have met the Medicaid eligibility requirement for the waiver.
Okay, great. All right. Well, thank you so much. So, we're actually going to end for tonight because I have a few things to share. But thank you, Michael. So, thank you so much. Honestly, this was a record-breaking night for us. So we had 385 people registered, and we had 162 people on on the Zoom, which was our number one ever most watched. So we are very thankful for you, Michael. And so one of the great things is that we will be seeing Michael a few times more coming up. So as a reminder, if you have not yet submitted your questions in the chat, please feel free to email them to me. It's mwyman@pcr-inc.org. And Margie, if you can just put that again in the chat. I also did put on the chat the 2 different contacts that Michael had shared. So if Margie, you can maybe add that as well. So it's on the top of their screen. But definitely, please, you're more than welcome to save the chat and print it out. So that's another possibility. So after the presentation, Michael will answer the questions and responses will be compiled into a document that will be emailed to participants and archived on the PCR website. Please note that we can only accept general questions and are not able to address specific individual situations. So I know that some people in the chat were asking very specific questions. And so for those scenarios, I would definitely recommend reaching out to one of the contacts or one of the, on the last slide that Michael shared about getting more resources, because unfortunately Michael and us will not be able to answer specific questions. But we are also pleased to share that Michael Dalto will be back on Wednesday, June 17th at 6:30 for a webinar on surviving Medicaid waiver redetermination. This presentation will cover the purpose of Medicaid waiver annual redetermination, how the process is intended to work, how it is currently working in practice, common challenges and how to troubleshoot them, and how to get help resolving issues and recommendations to improve the redetermination process. I will be sending the recordings, documents, and the compiled Q&A document to all attendees. These materials will also be archived on the PCR website. Looking ahead, our virtual transition times meetings will be held monthly through June. All meetings will continue to offer simultaneous ASL and Spanish interpretation and will be archived on the PCR website. And then looking ahead for next month, please join us on Wednesday, April 15th at 6:30 for our next program, Maryland Division of Rehabilitation Services Doors and Social Security. So Michael Dalto will be back to cover eligibility for Supplemental Security Income, SSI, and Social Security Disability Insurance, SSDI. And the Doors presentation will feature Valerie Pridgeon, Transition Rehabilitation Specialist for Montgomery County, and will cover programs and services that support individuals in obtaining employment. So thank you all for joining us this evening, and we hope to see you next month.